The topic of today is respiratory failure. Respiratory failure by itself, it's not a disease. It's a condition that would follow a disease, a serious disease that affects respiration or the whole system, or any other condition that is life-threatening that will result into respiratory failure. Respiratory failure does kill many people. That's why we need to discuss about it. We need to understand it. So that's why we need to define it. We need to understand the causes. We need to understand the sign and symptoms. We need to understand the complications. Then we need to find ways for treatment and prevention. Let's start on part 1, where in part 1 we are going to see the definition, the understanding the mechanism of respiratory failure. Respiratory failure is a syndrome where the respiratory system fails in one or both its gas exchange functions. You see, we know the lungs will take in oxygen and take out carbon dioxide. Now, when you check blood and you find that the partial pressure is less than 60, normally it should be above 75. But if it is less than 60, then you can confirm that there is a respiratory failure. If carbon dioxide is greater than 45, then you have to say there is respiratory failure. Normally, carbon dioxide should not go beyond 45 and should not go less than 35. But on this one, you can see it is going greater than 45. Then you can confirm there is respiratory failure. Respiratory failure can be acute or chronic. Chronic for longer time, acute just in short time. Now, acute respiratory failure is characterized by what? Life-threatening derangement of arterial blood gas. We are going to understand what these gases are. Alright? So manifestations of chronic respiratory failure are less dramatic and may not be as readily apparent compared to acute respiratory failure. Now, these are the gases, the blood gases, the gases that we find whether in the arterial blood or venous or capillary. But when you take blood, you check the gases in the arteries, you find that the pH between 7.35 to 7.45. So pH normally, when you talk about pH, neutral is 7. For example, the water, which is just neutral, the clean water, the pH is 7. The more you move to the left side, the more the number becomes smaller, the more the acidity becomes stronger. For example, when you check the acid in the stomach, pH is 2. That's too acidic, very a strong acid. When you move to the right, you go to the alkalinity base, okay? For example, baking soda is 80.3. When you check household bleach, pH is 12. We can understand now what is pH is in comparison to the different fluids. PCO2 normally should be between 35 to 45 mm mercury. PO2 should be 75 to 100. And this is PCO2 and this is PO2. Bicarbonate 22 to 26. Base excesses between -2 to +2. Oxygen saturation, the one we use when you are putting a saturometer on the finger to check what percentage of the oxygen in the system is. It should be always greater than 95. If it's below that, it means there is a problem of oxygenation. Okay? So this bicarbonate will be helping to bring a balance between this acid, alright, and alkalinity, so that it is maintained on the normal reference range. Acidity should remain here. If it goes below this number, becomes a problem in the system. Goes beyond this, it becomes a problem. So there is a mechanism in the body of trying to stabilize. It's very interesting to see how the organ works. and the kidneys looks like they're intelligent organs. When they detect acid in the body, what they will do, they will take sodium combined with the bicarbonate, which is called sodium bicarbonate. Then they will find a way to eject the sodium, okay, in the urine. Then you pass urine with the sodium. We remember sodium is salt, and we know urine is what? Salty. So the kidneys will throw the sodium away and take this bicarbonate in the blood, in the system, in the circulation, where this bicarbonate will come and catch acid. Acid is represented by H, okay, H+. Now it will go again with in the system have become already carbonic acid. The carbonic acid, when it reaches the lungs are clever also. What the lungs will do, they will separate water and carbon dioxide. Now when the lungs separate water, after separation of water and CO2, they will be able to eject CO2 outside and remain with what? With water. This is a very interesting mechanism, how the lungs and the kidneys clean the body. Okay, so two types of acute respiratory failure, as we said, there is hypoxemic and there is what? Hypercapnic. Hypoxemic, hypo means low, low oxygen. Hypercapnic, hyper means high concentration of carbon dioxide. So the two are not good for the body. There is what we call ventilation perfusion mismatch, and it is known to be the most common mechanism of what? Of both of these two respiratory failure. You can see when you talk about gas exchange, the blood will come from the heart, not oxygenated, and it comes, now they reach the alveoli. We are in the lungs here. This alveoli will be able to catch what? CO2. Catch CO2. As it enters, it also exchange the CO2 with the oxygen. Oxygen enters here, then it becomes what? Oxygenated blood. Then it goes back to the heart. All right. Look what happens in more details. The blood will come this way from the heart. It arrives where these vessels, these capillaries will be surrounding these alveoli. Exchange will take place. Oxygen comes in, CO2 goes out. So it continues like that as we breathe in and out. Now the blood, the red blood cell. This is a red blood cell. This red one, as we see it, what it will do with carbonic acid, it will be separated into two, where carbon dioxide will be ejected outside and water remain in the red blood cell. And now what happens after, because here we are in the lungs, here we are having alveolus, the oxygen will infiltrate, diffusion. It will get into here through this membrane. It will get into the red blood cell and will be captured by hemoglobin. We know this hemoglobin, the unit that gives the red blood cell the color of being red. Okay, then it captures this oxygen. That's why people who are anemic, they will have shortness of breath, because they don't have enough hemoglobin to capture enough oxygen. Okay, so the same mechanism, the oxygen comes in, then this alveolus, the blood comes with unoxygenated blood. They get inside for being exhaled out, but at the same time they inject inside what we call oxygen. Then it will be transported towards arteries, okay, but it will be in this case the vein, pulmonary vein, because they are going to the heart. Then they take blood to the heart to be distributed in other parts of the body. Same picture showing the direction and how it goes. It's very interesting. Thank you for being with us in this part 1. health education, health promotion, we are going to see also part 2, where we need to understand the causes of respiratory failure. We will see it a little bit in details. Thank you.